my name is Heinz Ludwig. I'm working here at the Wilhelminen Cancer Research Institute in Vienna, Austria, and I'm one of the local organizers of the 18th International Myeloma Workshop of the International Myeloma Society, which takes place here in Vienna from September 8 to September 12. And I must say it's a fascinating experience because it was questionable whether we would be able to organize an in-person meeting here, COVID pandemic. And there were some, I think, voices opting for having it completely virtual, but I think we need to set a sign. And so in the end, finally, we convinced all the others. So we have now a hybrid meeting where at least 800 researchers came to Vienna to discuss the newest research results in multiple myeloma. And I think it's important to have this personal interaction. So what is important for patients? I think there are many good news. Probably many of you know already the advances which have been achieved mainly with new immunotherapy approaches. And that is based on monoclonal antibodies, on antibody-drug conjugates, and on what we call BiTEs, which are bispecific antibodies, T-cell engagers, which bind to a T-cell on the one side and to an antigen of the myeloma side on the other side. So these BiTEs bring the T-cell, the cells which are responsible for cytotoxicity, in close vicinity to the myeloma cell to lyse the myeloma cell. And this principle worked out, and now we have different BiTEs. And these BiTEs, all of them target T-cells on one side, but on the other side, they target different epitopes on the myeloma cell. So BCMA, but there are novel targets, and there will be more targets in the future. So even if one target in the future will not work accordingly, you have other BiTEs available, which could then improve the result. And it's also thinkable that you combine several BiTEs. And what we do with BiTEs will be done with CAR T cells, which now we had an update of the most important trials of the CAR-T2 trial, which is ide-cel, which has fantastic response rates in heavily pretreated patients, 95% response rate, long PFS. It's wonderful to see that these treatments are working, and it's very reassuring to know that people are working hard to make them even better. And that's on the way. And we had a keynote lecture by Ken Anderson, which is one of the giants now in myeloma research, I must say. He's the mentor of many myeloma researchers, and he gave us his vision, which novel targets may be interesting to tackle in order to improve outcome of myeloma patients. So I think what we have achieved is, I think, remarkable. But it's clear for all of us that we need to move forward, particularly to improve the management of patients with so-called high-risk features. These are patients who can be defined by adverse cytogenetics, or can be defined by NGS or gene arrays, or by clinical factors such as plasma cell leukemia or short progression-free survival. So we have, it's a basket of patients with high-risk features, but most of them have these poor risk cytogenetics or genetic features. And these patients still face a difficult time because treatment is working, but not long enough. With that saying, I would like to encourage all patients to be physically active, to go back as much as possible to normal life, and to enjoy, I think, aspects in your life which give you self-fulfillment, and try to avoid things which may be stressful and so on. So I think these recommendations for all of us, I try to follow them themselves also, but I think if you're in a position where you have some burden on your shoulders like a significant disease, it may be quite helpful.